So, hi everyone. So today I'm going to try to convince you beyond what Nora has mentioned that you really likely need a statistician on your team when you're preparing your grant. I realize that you all are incredibly bright. That's why you're here. That's why you got to where you are. And you probably aced that 1 or 2 statistics class that you have taken, but you are not a statistician, most of you. And so there's no need to pretend like you're a statistician, which I see people do often. I mean, people come to me with the stats section written, and I rewrite it. I don't know why they feel compelled to write the stats section, but they do. So take advantage of the training of the statistician, and more importantly, take advantage of their experience. Statisticians have worked on tons of projects, and so they've learned subtleties that even newly graduating PhDs do not realize. So the first thing is engage the statistician early or risk poor outcomes. Poor planning leads to poor outcomes. Find that statistician, again, early. Provide them with your background information, relevant references. What references have you read? You know, I often, if it's an area I haven't worked in, I read the background papers. Give them a draft of your aims and then meet with them to discuss what your patient population is going to be, or where you're going to get your samples, and what your general aim is in terms of what you want to do with the grant. The statistician will help refine your study questions. Often I ask people if I'm really confused when I read their specific aims because they're not very specific or there are no hypotheses. I say, tell me at the end of the study, what data would say that this is successful? Or what data would say that this failed? And that way, you know, I can get a sense of what they're trying to accomplish, and it'll help refine the aims. Also, a statistician may help refine your endpoints to make the study feasible, and I'll come back to that in a minute. Also, make sure you have the right study. They'll help make sure you have the right study design and data to answer the question of interest. So a couple of examples of things that go wrong. So the hot thing today is to find a biomarker that's predictive of treatment response. So people say, okay, so I'll just get a bunch of treated patients and I'll see if the biomarker is associated with response. Well, that's fine. At the end of the study, if it is associated with response, all you know is that that biomarker is associated with response. It does not tell you you can use that biomarker to pick which patients to treat. If you want to do the latter, which is what most people want to do, is to find a biomarker to treat patients, what you need also is a group of patients that were not treated. And if you see in that group of untreated patients that there is no association with the biomarker, you've hit the jackpot. Okay, but you need all 4 groups of patients to answer that question. Another thing that people often do is poor analyses plans if they try to write it themselves. So let's say they want to compare overall survival of responders to non-responders. So what they do is they get Kaplan-Meier curves for the responders, Kaplan-Meier curves for the non-responders, and do a log rank test. That is an incorrect analysis. If you're going to do a survival analysis, right at the time that the clock starts, you have to know what group that patient belongs to, if they're going to be a responder or not. You don't know that when the clock starts for survival because that's an event that's going to happen in the future. And so that builds in what's called immortal time biases into your analyses, and it's incorrect. So other sort of things of poor planning that are along the lines. Do not expect your statistician to be able to provide you what you need by the end of the week. Okay, it's not fair to them. First of all, statisticians are incredibly busy. I mean, I probably have 50 ongoing projects right now, and it's not fair to come up to me and say, you know what, that deadline you've been working at so diligently for tomorrow, well, drop it and do mine because mine's due tomorrow. Okay? Also, what a statistician does is more complex than just pressing a button, which many people think that's all we do. Oh, just give me a sample size calculation. If that's all you're using your statistician for, you're probably not going to have a great grant. Statisticians help determine whether or not your study is feasible. You may think that you have tons of patients available. My institution sees 1,000 patients a year. I'm set. I don't have to worry about that. However, you forget that you're not interested in all 1,000. I keep doing that. But you're only interested in a subset of them based on maybe their histology or a marker or something like that. So that shrinks your sample size, and you may not have thought through clearly by how much that will shrink your sample size. In addition, if you have a time to an event outcome, such as disease recurrence or overall survival, what happens there is that what drives the sample size is not the number of patients, not all these people, but the people that have the event of interest. So in this case, there'd only be 3. Okay, and then that's probably not going to be sufficient for your study. So we do sort of like a Goldilocks approach to sample size calculation. Sometimes people come and say, I'm just going to do everyone we've ever seen, okay? And you go, really, you're going to abstract 5,000 patients? And in reality, you may not need to abstract 5,000 patients, and we'll save you that time and pain. In addition, if you're doing a clinical trial and it's an early stage trial, you don't want to overexpose a bigger population of patients than you need to. And so also, as I mentioned, and usually what statisticians get accused of is we come back and say you don't have enough patients. We say that a lot. I do realize that. But then we'll ask you, how many patients can you afford? And then based on that, we may have to revise sort of what endpoints you're using for your study and what question you can answer, i.e. instead of using an endpoint of overall survival, which is going to take 500 patients, maybe we can use an endpoint of time to disease recurrence, which may only take 250 patients. So if you tell me how many patients you can afford, I will work with that. And so the goal is to get the sample size just right. And in addition to this, as Nora said too, we will also make sure you're not over collecting data. What sort of just kills a grant sometimes is, people have these aims, they're all very nice aims, and then when they start talking about all the data they're going to collect and analyses they're going to do, a lot of these have nothing to do with the aims that they've stated. And so that's not good grantsmanship. Now I want to mention a few pitfalls. Avoid going it alone. As Nora said, you're building a multidisciplinary team. There's no reason you need to do each bit yourself. No one expects that. What you do as a PI is get that team together and get the best possible quality that you can of the individuals that will be part of that team, the dream team. Also, one of the key individuals, even if it's a basic science experiment, and you have mice models and so forth, should be a statistician. At least the statistician will tell you, you really don't need me. And I've said that a couple times, that it's just so basic that you don't need me, but at least you have that base covered. Another is seeking help too late. Haste will make for poor quality. Again, if someone comes to me and says, my grant is due by the end of the week, can you help me? I will try to help them. But again, if I find something really wrong with the study design, I have no time to fix it. Other thing, do not cut and paste. You've heard this before. And it's very obvious. Oh, Joe's grant is just like my grant, doing the same analyses, same patient population. I'm just going to cut that and put it right into mine. Well, there might be, if Joe's grant really is like the grant you're writing, why are you writing that grant? Okay, so there's subtleties that you don't realize. And then finally, don't leave the glaring hole. Again, you're hearing this over and over again, the glaring hole being lack of statistics. Finally, how do you find a statistical collaborator? Well, first of all, you might fall into it. Your mentor or lab may have someone they've been working with already, so that's really natural. Just work with that person because they know what you're doing. If you're in an institution that has a biostatistics or statistics department, they probably have an arm that helps that's collaborative and helps people with grants. If you're at a institution that has a NCI Comprehensive Cancer Center, they are going to have a biostatistics course, so that would be the place to start. And then finally, you may be in an institution that has a clinical and translational science center, and they also have a statistical core, and so you can go there for help. And so that's all I have for you today.
Thank you. How about some questions for Dr. Ballman? Karla, I have a quick question. A lot of times if you're doing something simple, I mean, many of us have taken basic statistical courses and we feel comfortable doing calculations. Would you recommend, even though you've had some training, to always try to run it by a statistician?
Yeah, I would recommend that because, oftentimes, and I've seen, animal experiments where you may think it's really straightforward and simple. Now, if it's two arms, I'm just going to compare this group to this group and that's it. And I know in the past we've used a t-test. That's probably fine. But when it starts getting more complicated, I've seen where experiments fall apart because they could reuse a control group more often than what they are and so forth. Also, there might be some subtleties. I think it's worthwhile just to talk to them. And the statistician will say, you really don't need me. So.
And we have another question.
Thank you. Great talk. Could you give me a couple examples on in vitro, experiments where the statistician helps? Because I did some work at the bench, and then I realized I was finding my IC50s the wrong way, and if you could expand a little bit on that.
Well, you just gave an example, right? And so, also, if I'm reading a grant, and I might let sort of in vitro experiments go by, but if it's an in vitro experiment that's using primary patient samples, like in a hematological type thing, there might be some more variability that's implicit there, and I want to know that someone thought about, well, how many replicates do I need to do? And it might be fine to say, look at my preliminary data, we used 3 replicates, it worked fine, and the differences we're looking for are so big that if we don't see these, I'm not interested. Then you've argued and at least stated why you don't need statistical analyses for that. But on the other hand, sometimes depending upon, maybe you need 5 instead of 3 replicates. It just depends upon, and the statistician can tease that out just talking to you. You may go back and they may not do anything more than have just talked to you and told you that you need maybe 5 rather than 3.
Thank you, Karla.